Good afternoon or good morning, and welcome to the second of a three-part series of virtual roundtable discussions on reimagining higher education convened by Young Invincibles. I'm Kyle Southern, and I have the privilege of serving as Policy and Advocacy Director for Higher Education and Workforce here at YI, which is a national nonprofit organization where our mission is to amplify the voices of young adults in the political process and expand economic opportunity to the young adult generation. The coronavirus and COVID-19 pandemic have already taken more than 300,000 lives globally and more than 90,000 here in the US. Social distancing has drastically altered the way we live, and the current economic halt has led to tens of millions of lost jobs. In this time of great loss, widespread anxiety, and tremendous uncertainty, we know that dedicated healthcare professionals are doing their best to care for the sick and comfort families in times of loss. We're also left to wonder what might be ahead for so many aspects of our society, including how we approach higher education. Our conversation today should push our thinking about the future of higher education while recognizing the status quo before COVID-19 was already a crisis for millions of students and more than 43 million Americans shouldering more than $1.7 trillion in student loan debt. Just as COVID-19 disproportionately affects communities of color, the student debt crisis has hit people of color especially hard. It's clear that in this moment of uncertainty, we also face the possibility of reimagining higher education into a more equitable, flexible version of itself, a version that advances more students who are realizing their goals, helping to build our new economy and civil society for the future. We're joined today by a great group to discuss the kind of leadership it will take to sustain higher education through this difficult moment and meet the public mission of higher education and it is uniquely positioned to fulfill. In a few minutes, I'll speak with Dr. Scott Cowen, who served as the 14th president of Tulane University in New Orleans from July 1998 to June 2014. Dr. Cowen provided critical leadership to his institution and city following the devastation of Hurricane Katrina in August 2005. We're also honored today to be joined by Dr. Zakiya Smith Ellis, Secretary of Higher Education for the state of New Jersey, and former official at the U.S. Department of Education and President Obama's Domestic Policy Council. Dr. Michael Sorrell will provide perspective as a current college president. He is now the longest-serving president in the history of Paul Quinn College in Dallas, Texas, which has pioneered an urban work college model under his leadership. We'll also hear a policy perspective from David Bagby, Deputy Chief of Staff to Representative Mark Pocan, who serves the 2nd District of Wisconsin in Congress. As you listen to these conversations, please make use of the Q&A button on your screen to submit a question for any or all of our speakers. A member of the YI team will be monitoring these questions and identifying several to post in the closing segment of our program. Please also keep an eye out to send your responses to a few poll questions on your screen as well. And please join the conversation by using the hashtag #ReimaginingHigherEd. First, however, Young Invincibles is fundamentally an organization seeking to put the voice of students and young adults at the forefront of these kinds of important conversations. We're sorry that our invited young advocate today had a conflict with the final exam that prevents her from joining us. However, YI has already collected a lot of blog posts from our young advocates across the country, and I wanted to share some of their words before we begin our conversation. In the comments box, you'll see a submission from James Hill, a first-year student at the Borough of Manhattan Community College and a member of YI's Young Advocates program. He shares about the challenges of managing finances and keeping up with coursework without a laptop or Wi-Fi access. We're also sharing the story of Nicole Benkert, a student at the University of Texas. She wrote about the mental toll that campus closures and the uncertainty of the future have taken on many students. And finally, for now, we're sharing words from Lyric Young, a City College of New York student. Lyric shared the angst many people, especially first-generation students, feel about graduating at this time and entering a job market that challenges people of all ages, but particularly young people with relatively little work experience. Having shared those words, I'd like to now begin our panel conversation by turning to Dr. Zakiya Smith Ellis, Secretary of Higher Education from the state of New Jersey. Secretary Smith Ellis, I'd love for you to start with just sort of giving us a landscape view of what's going on at the state level in terms of policy, what are you hearing from college leaders? And I think the last time I checked, New Jersey had frozen about $900 million in funding, including over $100 million to higher ed alone. So kind of paint for us a portrait of the principles you all are thinking about to navigate this time of crisis and what you're thinking about for the near term going forward.
Sure. Thanks for having me. It has been just a tremendously, I would just say, devastating experience here in New Jersey. We have the second highest number of cases and deaths in the nation after New York. We have over 10,000 New Jerseyans who have passed away due to COVID-19. We have over 140,000 and counting individuals who actually have contracted the virus that we know of. And so I just want to start with, the public health emergency, which obviously also affects students as well. They have family members and others, is really overarching everything here. Every time I'm talking to people, every time we have meetings with folks, they know somebody that has had coronavirus. I know several people that have had coronavirus. They know people that have passed away. And so the human impact of that, I think we have to take into account. And that is devastating. I mean, I think about things like Katrina when, you think about what comes next, but you also have to mourn a bit what happened, because it is a terrible thing that we're dealing with. And I pray every day that this is the worst thing that most people have to deal with in their lives. I think we'll be, we hope that this is the worst thing that we have to deal with in our lives. So having said that, the first piece and the first principle that we think about is really just getting the public health emergency under control. And as much as we think about the economic impact of this on institutions of higher education or businesses or the state, we will not have economic growth if we do not have public health taken care of. And we have seen all kind of modeling that tells us that, and that's the principle that's driving our work, that's driving our governor's kind of principles. I lead two task forces. I lead several task forces, but one mainly is non-higher ed related. So it's with people from the business community, social services, faith organizations. I just talked to them earlier today, people not being able to have religious services in the way that they're used to. This, really has an impact on people's mental health, the kinds of services that you're able to provide, funerals during this time when people are passing away at higher rates and not being able to gather in that way. So thinking about how then we transition from where we are now, and we're starting to see some positive indications of declining hospitalizations, declining rates of infection. That's kind of the mindset. Our budget has been cut because we've shut down most economic activity. So you can imagine the state budget is decimated from sales tax and income tax. For income on the sales tax side, there's not business activity happening, right? So we're seeing sales taxes pretty much flatten out on a large degree. Income taxes, just to put it in perspective, we in New Jersey have received more applications, or had received more applications for unemployment insurance within the first few weeks of the pandemic than we received in all of last year. So it's just an overwhelmingly challenging situation from a state finance perspective. And this is a state that doesn't have a strong kind of financial footing. We didn't have a rainy day fund that we're pulling from. We didn't have lots of state reserves. So getting out of this is going to be painful. And I think it's important not to be too sanguine about what that means, and to be, thinking that we're going to have painful cuts, and the cuts. So thus far we have things in reserve. I think next year they're projecting a $10 billion deficit on a $40 billion budget. And so just being realistic about that, our principle to move forward in the most positive way I can is just to say, how do we protect those that are most vulnerable in this time? How do we move forward giving guidance to institutions about how to continue? How do we have laptop rental programs? What are some creative ways that we can ensure students' education continues even in this environment, but keeping health and safety first? And so those are kind of the things that we're thinking about. The first principle is really just about public health and safety. And then I would say the second main thing is about moving forward in a way that puts equity first and prioritizes those who are most in need in our restart and recovery efforts.
Great. Thanks for giving us that sense of the scale of what you all are facing there, and also really appreciate foregrounding the real struggle and loss that lots of people are feeling right now. Dr. Cowen, I want to turn to you. I'm not sure that I shared this in preparing, but in many ways, an article that you wrote for Inside Higher Ed back, I think about April 1st, kind of inspired us to do this series when you wrote about getting up on the balcony in a time of crisis to think about what's the landscape and how do you think about the obligation to change and move forward. So in a time like this, or a time like when you were leading Tulane in the aftermath of Katrina, what does it mean to sort of get up on the balcony and think about leadership from an institutional perspective, but also as part of a broader community?
First of all, I have this notion that when there is a crisis like a Hurricane Katrina or the COVID, we have an obligation as leaders to make sure that something good comes out of it, that there are silver linings, such that if it had ever happened again, we would not have the damage, the hurt, the losses that we had because of the pandemic when we had it now. So my view is that at the very time you're trying to recover from the crisis itself, it's good to put together a skunk group, if you will. We used to call that a skunk work group, to really begin to say, don't worry about the day-to-day of recovery. We'll take care of that. Help us understand how we can make this a better institution, such that if it happened again, it would not cause the damage it did. So that's called up on the balcony. And actually, the phrase up on the balcony comes from an article and research done by a professor at Harvard, where he said you really need to get above the fray and really think about the future. So I put together a group in the fall of 2005. I chaired the group, but I asked 5 university presidents around the country to come and meet with me 4 times in the fall of 2005 to help me get to the balcony, to think about the future of Tulane University, because I knew that we would never go back to being exactly the same, no more than any of our institutions will today. So anybody who believes that after this is over, you're just going to go back to the old ways, I think is naive. It's going to have a profound impact on institutions and higher education. So excuse me. And the first thing I said was, there are 3 things that I want to make sure that we think about as we think about the future. One is the health and welfare of all of our people. How can we ensure that if this happened again, we would be able to protect them better than we were able to do that? The second one was, how do we actually become a stronger institution academically, where our stature, reputation, and the substance of what we do is even better than what we had? And the third is, how do we become financially viable? And I said, within that framework, what should we do differently? And that group helped me over a period of 6 months. And I had a similar trustee group working on the same issue. And I also had a faculty group working on the same issue. Out of that came what we called a renewal plan, where we used what we had learned through Hurricane Katrina and what we thought about the future to totally transform Tulane University. At the time we did it, people said it was the biggest transformation of a university in 100 years. I don't know whether that's true or not. That wasn't my quote, somebody else did. But we really did change it. What I would say is people ask, well, was it successful or not? And I say, well, all you have to do is look at the Tulane today in the last 3 or 4 years, and you'll see that it was by about any metric you'd use. The other thing that I think we have to understand is when there is a crisis like a Katrina and like this, it is not over in 1, 2, or 3 years. The impact of it will be felt for years. So any institution is naive to think, well, if we get a vaccine or if we have tests for everybody, somehow it's going to go right back. It's not. It's simply not. And therefore, getting to the balcony early, but setting it up as a separate process and not commingling it with the day-to-day things you have to do, I think is very important for an institution. And that was the thrust of the article, to say, it's time now for each of you to come together and put together your own group to think about what the future of your institution looks like.
Well, thanks for that background. Then maybe it's a good opportunity to turn to someone who's currently leading an institution down in Dallas, Dr. Sorrell, and as Dr. Cowen was talking about his story, I saw you sort of rubbing your forehead and thinking about the challenges that are ahead. So let me turn to you and just sort of get a sense. You came to an institution that was in a time of crisis when you assumed your presidency, and it really led a transformational effort there. In terms of thinking about leadership principles, how are you thinking about applying what you started with and what you've learned to date as you think about confronting the future of Paul Quinn?
Well, first, let me say how honored I am to be here. It's great to see you again, Kyle. And anytime I get to hang out with Zakiya, I am a happy man. And President Cowen, it's good to see you as well. I haven't seen you since I was down on Tulane's campus, and I can comment firsthand to the transformation that's taken place there. And David, I don't know you, but I'm looking forward to getting to know you, right? But let me say this: what we went through at Paul Quinn has really sort of emboldened us now, right? I mean, so we've had our existential crisis, and I remember the conversation that I had with some other college presidents at that time and they were, in a sense, some of them were being sort of dismissive of us, right? And what I tried to explain was that everyone goes through a crisis, right? Like if you live your life and you never have one crisis, that's an anomaly. For us, we just got there earlier, which gave us the chance to develop a sort of a crisis response methodology and mindset. And so, what we have done is we are constantly on the lookout for disruptive events that occur outside of our boundaries, right? So, we pay attention to things that take place in the world that could have a trickle-down effect on us, and we game plan for them. So when we saw what was going on with the coronavirus, we sort of huddled up and said, this could really spiral, right? And it could spiral for lots of reasons. One is that, you need a national response plan that we didn't see in place at the time, right? And so we didn't have the luxury of thinking that, oh, this would just magically go away. And as we started game planning for it, we started asking ourselves some very different questions. And much, like I imagined some of the questions that President Cowen thought about. And we said, all right, what could this mean for us? Who can we become on the other side of this event? Because I think when people go through crises for really the first time, or they have their confidence shaken for the first time, they think that's the end of the world. And what we always try and tell our students and our staff is like, we will get to the other side, right? This won't always be our state of being. The question we have to ask ourselves is, who do we want to be on the other side? And is this an opportunity for us to address some areas that we frankly aren't good enough in right now? And this gives us the opportunity to adjust them. And so we began adjusting them. We knew we were going to send everyone home at least a week and a half prior to when we sent everyone home, right? And we also have taken the position where if there's no vaccine, if there is no widespread testing, we don't feel comfortable bringing students back to campus in the fall. Now, we reject this language of, are you going to reopen? We're already open. We've been open. We never closed. And I just think that, it's a mistake for people to continuously say that. And we're not judging what anyone else does and the decisions they make. We just have looked at this from a science standpoint. And this is how we look at all crises, right? We do a very honest assessment of what are the circumstances, what are the situations. And so, for us, we're using this as an opportunity to implement new academic programs, to do physical changes to our campus, to game plan for the opening up of 2 other campuses, while we wait for the rest of society to become safer, right? And we're going to change the way we're partnering with an entity right now to create a online educational method that is attractive and more viable for students from under-resourced communities. Because one of the things that, our students from under-resourced communities, 85% of our students are Pell Grant students, and they tell us they don't like going to school online because we use a hybrid method. Half of your class experience in any particular course is online, half of it is in person. But then when you drill down to why don't they like it, it's because it's associated with experiences of abandonment and feelings of abandonment and being ignored in the traditional classroom environments in which they've had. But that doesn't mean that they always have to be that way, right? Like that's just an invitation to you to devise something better. And, the attitude that we have taken, and I love my faculty for having this attitude as well, is they have said, so let's get this straight. Everyone does everything online now, right? They play video games online, they date online, they have social engagements online. Are you now going to tell us that the only thing online that people don't like is their educational experience? That just means we haven't figured out how to connect with them online. This is an invitation to that dance.
That's a great sense of where you are right now. And in terms of thinking about this question of reopening, we just had a poll question go out asking our viewers if, knowing what they know now, would they be comfortable going back to residential campus this fall? And 75% said no, and 22% were unsure. So not a scientific poll, but gives us a sense of where folks are. And you felt strongly enough about this to write in the Atlantic to say that colleges are deluding themselves and they're going back this fall. Without necessarily getting into the if-thens of that question, I'd love to hear your perspective just from a leadership perspective. As you feel the need to speak out on that and to speak up for students, how did you think about that and deciding to do that piece, and how are you thinking about that in terms of going forward?
Well, I think there's an enormous amount of groupthink in higher education. And I think, and I'm just going to be very, very candid. I think there are far too many people in leadership positions in higher education who are more concerned about their prospects for their next job than doing the job that they have, right? Because in higher education, it's the only area I've ever worked in where people openly talk about what they're going to do next. When I was a corporate securities lawyer, if I told a partner that I didn't want to work on a certain transaction because it didn't really position me well for what I was going to do next, I would be off to next very, very quickly, right? And so it's a different culture. And I think there are people doing an unbelievable job right now in this space, right? I think what's going on in Southern New Hampshire is just fantastic. I think what Michael Crowe is doing at Arizona State is, what you would expect Michael Crowe to do, right? Like, I think there's some wonderful examples in this space, but I think there are a lot of people who aren't really being upfront about this. And, and it's okay to say, we're scared. We have no idea how to manage this moment, okay? We don't really want the students to come back, but we can't afford for them not to come back, right? Like, what is wrong with having that conversation, right? It doesn't make you weak. It doesn't make you an ineffective leader. It actually makes you a better leader, I would argue, because transparency is a wonderful thing. So I started reading all these pieces about, oh, we are going back to school and, we're going to do this. And I was just like, how, right? How exactly are you going to do that? We have no vaccine and we have no widespread testing. Without those two things, it is going to be extraordinarily difficult to keep people healthy and alive, right? Like, that's just this isn't whimsical thought, right? This is like a global pandemic. There are rules to this. There are rules that have existed and been created because of the examples historically, right? So what people effectively were saying is we're going to become comfortable taking these risks for whatever other reasons. And, look, I I'm an unapologetic advocate for students, okay? And I'm especially an unapologetic advocate for those students who come from places where people typically don't listen to them, right? And I just think, I mean, in writing the piece, I just thought, look, I'm gonna give voice to the fear that we have as an industry. And that is a legitimate fear. I know what it is like to wonder how you are going to make the economic requirements of your institution. I am incredibly familiar with that, right? But I also know that we exist with a compact with our students. It's a contract, right? And the foundational basis of that contract is that we will take care of you, that we will look out for your best interest. And I felt very strongly that if we're going to take care of their best interest, then we need to tell them, this is what's going on. This is what we're afraid of. And, you know, and I resisted my playful side, where to include, you know, conversations about the motivation that fall football is creating for people to come back and go to school, right? I mean, I left that part out just because, you know, I mean, I'm sensitive to others, but, you know, it's just, I mean, I just think that we as in a sector should just be more transparent.
Let me build
Yeah,
on.
I'd love to get your thoughts on that, Dr. Cowen.
Yeah, let me build on what Michael said. Listen, the first thing institutions have to think about when they're reopening is, what goals are they trying to achieve? What is most important? Michael said it well. The health and welfare, not just of students, but faculty and staff. That's number one. Then you can talk about finances, you can talk about other things, but that's number one. Right now, as we're sitting here today, you can get no comfort that the tools are in place, like the vaccine, like the testing, like the tracking, that says that you can protect students when they come back.
That's right.
There is none. So talk about the science, that's what the science is saying. Now, what they're trying to balance that off of is the fact is, boy, if we can't come back, it can't come back, and it's all remote, what's the impact going to be on us financially? That's a very legitimate question. And they've got to think their way through it. Yesterday, I facilitated a discussion among 40 university presidents on this issue. And it was fascinating. And one of the things we talked about was California state system is the first system that I know of, and the only one who said they're going to go completely remote. And they were unapologetic yesterday on the call to say that's the only way they can get comfort with protecting the students. I asked them, what's the impact on the finances? It's devastating. But then they said, but what would happen if we do have them come back? And in fact, there's a resurgence of it, or it just spreads. What is the impact both reputationally and financial to it? And that's the benchmark. You got to say to yourself, how do you justify not saying, listen, we're just going to do this all remotely, at least for one semester. Maybe things will be different. We don't have to spend all year. But this is what they're really juggling it, because they're bouncing off on the finances and everything else. But you still keep coming back and saying, science, good thinking says you don't open up in the fall to have students come on back on campus.
Well, thanks for that insight too. And I'm conscious we've heard a state level perspective, and now we've gotten to institutions and the challenges you all are facing. I want to turn back here to DC for a moment to think about a federal policy perspective from David. And so in hearing and knowing well the questions that state leaders are confronting, that institutions are confronting, David, where are you seeing the most urgent need for a federal policy that can support students and help institutions as well navigating this? The CARES Act has provided some funding for emergency support that's rolled out in some ways good and in some ways worthy of critique. But in terms of where Congress is now and what can be done in a federal perspective to hopefully build a a better financial model for higher ed going forward, what are you and your colleagues thinking about right now?
So I think first and foremost, we would agree here in DC with the institutional leaders on this panel that testing and addressing the immediate health and protection of students is going to be first and foremost, and that applies to every American. And I'm sure those thinking at the state level, like Dr. Ellis, would agree with that. And so I think testing, vaccines, investing in research, that's an integral part of everything that we've done so far. I think once you get past that immediate health issue and you start thinking of student well-being beyond immediate health and the financial picture, so impact on employment, whether theirs or their parents or someone in their household, college affordability, debt obligations, student loan relief. Also, as someone who exited law school at the beginning of the Great Recession, my heart goes out to any student who's graduating, this year into this economic uncertainty. That's a real concern that will have lasting impact on students that Congress needs to address. It's not just current unemployment, but just future impacts on the economy more broadly. And so we have had a focus on small business initiatives and loans to businesses. And it really runs the gamut. But I think we're just now we've had 4 coronavirus aid packages pass through Congress and get to the president's desk. We've been working on the 5th, the House of Representatives, led by Speaker Pelosi. We had pretty much a Democrat-only drafted bill that we passed, largest bill ever passed by Congress, $3 trillion. We're just now getting to where the heart of that bill was $1 trillion for state and local governments. And there was a sizable higher education component to that. In my opinion, I don't think we quite met the needs that will be there for institutions, and I think we need to come back to that. But you have differing needs across states and across institutions. So say Wisconsin, University of Wisconsin, UW-Madison's in the heart of our district. University of Wisconsin is the largest employer in our state by 3 times the next largest employer. So how the system goes is kind of how our economy can go in many ways. So it's important to make sure they're taken care of. And at a time where the last decade you saw attacks on state level funding for higher education institutions in our state, how we exit this crisis and use this moment, as Dr. Cowen spoke to, will be imperative to how institutions fare for the next decade if you're a public institution, and how you can leverage state financing. So I think how the federal government can assist states in meeting the needs of its systems will play an important role, as Dr. Ellis said. If you've got a $10 billion hole in a $40 billion budget, what do you do about that? And frankly, a lot of people are going to focus on K through 12 needs first, I think, and given the child care issues and getting back to work and everything else. So I think higher ed's in a precarious position. And then beyond the public universities, if you attend a small or work at a small independent college, they're going to have unique needs as well. Your endowment's not that large. If you have a decline in revenue, you possibly have a decline in enrollment. And then the students that you do have or that you will be appealing to will have greater financial need. Every single one of those components is a greater burden on the institution itself. So it's amazing to hear such positive outlooks from the presidents and past presidents on this call and just the phenomenal current leadership. But frankly, I think we in DC need to do more to help the inspiring leaders who are on this call. And that's what I'd say to that.
Yeah, thanks, David.
Let's say amen. Let the church say amen.
Yeah. We got some praise hands. We got everything going here. We had a quick poll question. David, I'll turn this back to you, and then I'll go back to Dr. Ellis. We had asked, amongst the different options we provided, where we saw the best way to support students for the long term, whether it's more flexible classrooms, sort of changing the academic schedule, something more like a federal-state partnership for tuition. But nearly majority have said, improving basic needs for housing and food security, which I think also speaks to the urgency of the moment. It also really elevates, inequities that I think we've known about for a long time, but have been really pushed to the forefront. And seeing how this pandemic has affected different communities. So talk for just a minute, if you would, about kind of a broader sense of how we can intervene, whether it's through tax policy or EITC or SNAP benefits. What are the ways we can better support students and young people, even beyond kind of those direct on-campus measures that we know need to be taken as well?
And I think all of the above on the issues that you mentioned, whether it be EITC, whether it be SNAP benefits, what we are facing in this pandemic touches every component of people's lives. And as everyone on this call has touched on, students are people first and foremost. They're not commodities to an institution. They're not just absorbers of an academic product. I mean, you have to address vital needs first. And I think that's been spoken well to by every panelist on this call. But getting direct assistance that allows someone to ensure a roof over their head, ensure access to nourishing food, and to make sure that their debt obligations aren't so large that all they feel is anxiety in their lives. I mean, all of those components allows them to be in a healthy state, to actually be a productive student, you know, once your needs as a person first and foremost are met. And clearly some communities are being left behind in that regard by DC, and we need to do more. We're pushing for that. We need some help with our friends across the aisle from where I'm sitting, in my opinion. But we're doing the best we can in that regard. But we need everyone who's on this call and watching to make their voices heard and their needs heard. Frankly, it's one thing for me to talk at someone and say, we should do this. It's another thing when people share their stories and their real struggle and say, here's how you can help me now. Please go do it. At the end of the day, politicians want to win elections, and they're going to be responsive to people who express those concerns. It's no different than a president has to be responsive to his community or her community as they're leading it as well. Those things go hand in hand, I think. That'd be my quick comment on that.
Yeah. And I want to remind people that are viewing today that we want to hear your voices too right now. We've got a Q&A function on your screen, so as questions come to mind, feel free to send those in, and we'll be monitoring those and bring those into the conversation. But I want to bring Dr. Ellis back in. We've heard from kind of the federal policy perspective. I know that in New Jersey, some new bills have passed just in the last few days. I think in many ways try to protect at least state aid going forward for students. And it kind of reminded me of how the CARES Act has taken steps to protect the Pell Grant and others for students. But talk to us about the work in New Jersey through your legislature from a policy perspective at the state level to protect students' aid for going forward.
So we actually have, tomorrow's a big day because the treasurer for the state will be announcing kind of what the near-term few months look like for us. For the first time in the state's history, the legislature and the governor decided to push back the budget deadline. And so unlike at the federal level where there's not, it doesn't really, the budget deadline doesn't really mean anything because you could just do continuing resolutions. It's real in the state because if you don't have a budget, the state does shut down. We can't not have a budget. We can't not have appropriations. We can't just borrow or print money. And so it's supposed to be June 30th, and that got pushed to September 30th. And that was done because we were dealing with coronavirus, and the legislature and the governor decided that it wasn't feasible to really, we would have been in the thick of budget hearings and things like that right now and negotiations, and it just wasn't feasible to deal with at the time. So tomorrow our treasurer is going to be announcing kind of what does it look like for that interim period and what kind of decisions is the governor proposing. Having said that, there's a lot of unknowns right now. I think without additional federal help, a state like New Jersey is going to have no choice but to make some really painful decisions. Not sure what those will be, but it's like if we're looking at the size of a hole that we think we're looking at, there's not like I think one of the things that I didn't fully appreciate before coming to the state level, it's not like the state is spending a bunch on a really frivolous stuff. It's like they're spending on police and prisons and colleges and K-12 and and healthcare for people in hospitals. And so our hospitals are even hemorrhaging money right now because, I found out through this that they make a lot of money on elective procedures. And so when those are shut down and you can't do that, they were losing millions of dollars per day. And those are the folks that we need to be like dealing with the public health emergency. And so obviously in the near term, and part of what led to what was in reserve was the state was just trying to make sure that we preserved funding for healthcare so that we could actually treat people with coronavirus. which meant that there's less funding for, things like higher education, K-12, et cetera. And I think moving forward, again, unless there's some robust federal funding, it's going to be difficult to figure out how we move forward. And the principle that I have in mind and how we're thinking about this is, how do you protect those who are most at risk? How do you make sure that whatever funding decisions that are made are really protecting the most vulnerable populations in the state, including the most vulnerable college students? And I feel like a little bit of deja vu. It didn't feel quite this bad, but I was in the Obama administration after the Great Recession when the Pell Grant had a $20 billion shortfall. And we had to make some difficult decisions that we still live with to this day in some ways about summer Pell. That was when summer Pell got cut, about ability to benefit and other things. And I remember looking at the list, and the list was like, well, do you decrease the Pell Grant for everybody, or do you decrease it for people that were going in the summertime, or do you decrease it for students in this category? But there wasn't like some fun option that didn't hurt anybody, because all of the options are bad. And so I feel a little bit of this, and I will say the reminder that in this time, particularly when we're facing those tough decisions, is the time when we should be thinking about how to move forward. Like Dr. Cowen said, how do we think about what this could be in the future? Really rethinking online education. As President Sorrell said, really rethinking about how do you engage. And it is painful. Sometimes you have to force innovation out of crisis. But usually I think what people want is more money to innovate. So they want to say, give me an innovation fund, or this is like not that time. There's not a situation in which the state government is going to be able to do that in any way. So it's kind of innovation in reverse, right? Like than what people would want if you're forced to do this because there's no other option. So what innovative way can you provide student services online? We have student support services, like a kind of statewide TRIO program. What does that look like for students that need that extra support when you're not doing small group in-person activities where everybody's like huddled together and hugging each other, because that's not safe. And so that is forcing some innovation in ways that I think we'll see in the next couple of months. But from a fiscal perspective, it's going to prompt some really difficult decisions in the probably next 2 or 3 months.
Thanks. And David, I want to come back to you in just a minute, but I first want to go back to Dr. Cowen and then Dr. Sorrell. I've got a question come in, about how well this pandemic has demonstrated that it is not exactly it's not a great equalizer. And we know this is proportionally affecting low-income people, people of color. We also have seen how dramatically folks from the middle class can quickly slip into difficult financial situations. So from an institutional perspective, thinking about the changed landscape of family finances, how can a place like Tulane, a place like Paul Quinn, think about socioeconomic equity going forward, knowing what a critical part higher ed is in society of providing a way for people to advance economically? Start with you, Dr. Cowen, and I think you're on mute.
It's been stunning to see the impact that this is having for people in under-resourced homes and families. In New Orleans alone, by the way, 70% of the deaths from the virus have come from African Americans, even though they only represent 32% of the population. That's stunning. And then you understand what's happening on our campuses with, once again, students from under-resourced families, regardless of color. And they are suffering much, much more than any other students. Everything from not having availability to the technology they need to be able to do Zoom or whatever it is that you're using, to having a place to go and live, to get a meal, to have support systems. And it is a tragic part, and it's really put an even larger spotlight on what's going on. The health disparities, as I said, is rampant around the United States. That when the virus first started, it actually impacted wealthy people in the United States because they happened to be abroad and then brought it back to the United States. But as it spread in the United States, it increasingly and disproportionately affected people of color and in the lowest socioeconomic classes. Something has to be done about that, not only in the context of this particular issue of the virus, but the larger one for the long term. We have had this issue of the haves and the have-nots and the inability to create equity and inclusion. We all like the words, we know what they mean, we'd like to do it, but the progress has been, in my view, very, very slow and unfortunate. And this is only exacerbating it, both in deaths and, once again, students of color and lower socioeconomic classes being able to go to college, much less continue it once they're in because of this.
Thanks, Dr. Sorrell.
It's interesting because we at Paul Quinn decided as part of our institutional ambition was the eradication of intergenerational poverty, right? So every day we show up for work, laser focused on creating programs and creating a pedagogical model which would allow us to address these issues. It's one of the reasons why we've implemented reality-based education, which gives our students, we only charge about $16,000 a year for everything, right? And by the way, we're going to cut that for the fall and for the spring and charge total cost of attendance being $12,000, right? Because people don't have it. Okay, now, we don't have a slush fund. We're making some adjustments as a result of that, but we just thought that was the right thing to do. But students have what they major in, then they have experiential learning because we're a work college. And then now we've implemented, we were always scheduled to implement this fall, a credentialing program where every year students get 1 to 2 credentials, industry recognized credentials, which they can then use in case they majored in something they don't want to do anymore, or their internships no longer fit their ambitions. So you've got to help people by giving them a different pathway. But what we really have to understand here is that I don't think we as a society care that much about equity, right? Because if we cared about it, we would do something about it, all right? I think there's a segment of people who care, right? But it's not enough to actually push it over the end because too many of us view it as a zero-sum game, right? So we say, well, if you need more, the only place for you to get more is for me to have less. And that's a scarcity mindset, right? That is not a mindset of abundance. It's not a growth mindset. It's whatever term you want to use, right? How we should be processing this is, how can we expand the pie so that people have what they need, right? And we don't do that. I mean, here's an example. So colleges and universities, how about we just make sure every student has access to a laptop and Wi-Fi, right? Let's just do that, because that's what we said we're going to do. We made sure every single student had a laptop that needed a laptop. Then we got to a place where we were like, oh, wait a minute. Now some folks need Wi-Fi because they live in cities that don't have access to Wi-Fi. So now we've had to go back, raise money, and for the fall, every student that wants one and needs one is going to have a hotspot, right? And that's expanding the pie, right? That's saying we're just going to give everybody a level playing field, right? And to touch upon the fact that more people of color are dying, like African Americans are dying at 3 times the rate of everyone else, okay, or I guess of Anglo American. That in itself is a reason why schools should go to school remotely, okay? Because disproportionately, this is going to impact segments of our population differently. And we can't be cavalier about that. We can't pretend that that's not the case, right? We have to actually show that we care a little bit more. And we have to actually understand why that's occurring. Some people say it's underlying conditions. Certainly that's some of it. But a large part is also the quality of care that people are receiving. A close friend of mine in Chicago lost her mother to COVID-19. And she couldn't get her mother tested. They kept taking her mother back to the doctor, and the doctor said, "We don't want to test you." Right? Like, I mean, maybe that's what it is. Now, because of that, her stepfather got it, her father got it, her stepmother got it, right? So she's dealing with just the mental stress of the possibility that you could lose everyone. Now, thankfully, her mother died, no one else died, right? And it's hard to say thankfully that your mother died, right? But she lost one of the four. But the standard of care, the quality of care that they received was substandard. And that just shouldn't be the case, but we know it's the case. We know where you live predicts so much of how the outcome in your life is going to be. But at some point, we as a society have to decide that we care, that we really, really care. And if we're not going to have that behavior modeled from the places we traditionally see it modeled, then it needs to be modeled from places where everyone has at least the aspirational goals of being, and that's in higher education, right? That's our educational system. We can be the leaders that we aren't seeing on other levels. And I just think that's what we should do. That's what we're committed to doing at Paul Quinn. And I think that's what all of us should do.
Well, I want to turn it back to David. We have just a few minutes, and we had a question come in. Most of the folks watching this are education advocates, David. If you look at a poll we found earlier in the program, it would be great to maybe close this out of thinking about I know that the HEROES Act is about an 1,800-page, $3 trillion bill, so we're not going to go through it all right now. But for higher ed advocates in particular, what do you see as the most important points for them to know about going forward? And what advice would you give to young people in particular who want to advocate for themselves at this critical time in the legislation that's going to move through in the next few weeks?
I think I'll take those in reverse order. So first things, what you can do, blow up your senator's phone lines and say, help us. Say the House has done something, do something. I told you my frank opinion. My boss may not like it, but that I still don't think the House went far enough. So you want to blow our lines up too and say, do more, not just for institutions, but for people and for communities that need help the most because they're being underserved, whether it be health, education, what have you. Like, just call people and say, do more. At the end of the day, it's a person on the other end of the line, and your stories matter most. So that's what I would say do right now. Because right now, Senator McConnell, the head of the Senate, he has said, what the House did is a non-starter here. Frankly, we don't feel any urgency to do anything in the next week, likely not in the next 4 weeks, perhaps. You might be weakening a little bit on that out of news that's come out the last few days. But if we go another 4 weeks without getting aid to folks, it's going to be rough out there. So that's what you can do. What's in the HEROES Act and what the House did. Essentially, there's about $90 billion in education aid that was set aside for states, about 30% of that set aside for higher education. There's about a $10 billion pot for institutional aid. There were several components of the bill that were built around $10,000 in student loan forgiveness for those who were most in need. So I think we probably could have gone further in enhancing affordability in general, being bigger and bolder. I mean, frankly, members should sit down and look at Paul Quinn and see what real inspirational leadership and solutions look like. There's very basic things you can do to help a student. Give them a laptop and Wi-Fi. How hard is that? We're talking billions. You're talking a laptop. Like, again, first order needs we already spoke about on this call. So we did a lot of good things in HEROES. I think we can do more. And honestly, the fact that the Senate is not moving quickly gives us time to push for additional measures that are common sense solutions like Dr. Sorrell is talking about when he talks about what he's doing at his institution. And I would encourage you to contact all of your electeds. Again, knowing that your state electeds that Dr. Ellis was talking about, their hands are tied in a way that federal leaders are not. They have real constraints. So I would certainly let everyone know you need help, but certainly focus on the federal government leaders at the moment, because they need to hear from you most to spur them into action.
Well, thanks, David, and thanks, Dr. Cowen, Dr. Sorrell, Dr. Smith-Ellis, and what I think we'll all agree is a very fast hour that's gone by, touching on some huge challenges for higher ed and for society in general, but I hope that our viewers have taken some inspiration and some insight, both for how to build from here, how to take care of each other, and how to hopefully push higher ed in a more equitable direction going forward. I just want to close us out now by inviting everyone to join us next week at this same time for the third and final session as part of our series. I'll be joined by another young advocate, as well as by Aaron Howard, the Latinx Outreach Director at Bluegrass Community and Technical College in Lexington, Kentucky, Dr. Tiffany Jones, Senior Director of Higher Education at the Education Trust, and Dr. Tia Brown McNair of the American Association of Colleges and Universities, and co-author of the book, Becoming a Student-Ready College, A New Culture of Leadership for Student Success. From Capitol Hill, we'll also be joined by Aisa Canchola from the Office of Representative Ayanna Presley, who serves the 7th District of Massachusetts. Our topic for next week will be Making Colleges Student-Ready. Please register and plan to join us for this critical discussion on the future of higher education next Thursday afternoon. Again, thank you to our speakers, our many team members at YI who made this program possible, and to each of you for joining us. We hope that you will be able to join us next week. And until then, please visit us on our website at younginvincibles.org and follow us on Facebook, Instagram, and Twitter. Please take care of yourselves and join us again soon.